everyone, I am Jamie Lynn Becauco, your student nurse. For today's video, I'll perform a return demonstration to assess the neurologic system. But before we hop onto that video, let me show you what equipment we'll need for today's assessment. So without further ado, let's get started. So before performing this procedure, we have to perform proper hand hygiene and don our PPE if necessary. After that, we can now proceed to the assessment. Good day, Mom. I am Jamie, your student nurse from Our Lady of Fatima University. So, Ma'am, for verification, can I ask what is your name?
My name is Hazel May Tampidik.
And when is your birthday?
May 11, 2003.
How about your age, ma'am?
I'm 20 years old.
Okay, so that is the first thing that we need to do. We have to identify our patient for us to ensure that it is the right patient in front of us. If there are any curtains or any doors in the room, we have to close them as well in order to provide privacy. Okay, ma'am, before we start, I would like to ask you some questions. So, do you experience headaches, any numbness or tingling?
Nope.
Do you experience seizures?
No.
Do you experience dizziness or lightheadedness or problems with balance or coordination?
No.
Have you noticed a decrease in your ability to smell or taste?
No.
Have you experienced any hearing in your ears or hearing loss?
No.
Okay, have you noticed any change in your vision?
No.
How about, do you have difficulty understanding when people are talking to you?
No.
Do you have difficulty making others understand?
Definitely not.
And do you have difficulty forming words or comprehending any expressing your thoughts?
Nope.
Okay, do you experience difficulty swallowing?
No.
Have you lost bowel or bladder control, or do you retain urine?
No.
Okay, do you experience any memory loss?
No.
How about, do you experience any repetitive involuntary trembling, quivering, shaking, or other movements or tremors?
No.
So, ma'am, for your past history, have you ever had any type of head injury with or without loss of consciousness?
No.
And then, have you ever had meningitis, encephalitis, injury to the spinal cord, or a stroke?
Nope.
So, ma'am, for your family history, do you have a family history of high blood pressure, stroke, Alzheimer's disease, dementia, epilepsy, brain cancer, or Huntington chorea?
Nope.
Okay, for the lifestyle and health practices, do you take any prescription or non-prescription medication?
No.
Do you smoke?
Definitely not.
Do you wear your seatbelt when riding your vehicles? Do you wear protective headgear when riding a bicycle or playing sports?
Probably.
Can you describe to me your usual 24-hour diet recall?
I drink coffee in the morning, and for lunch, I eat curry and rice, as well as for dinner.
Okay, have you ever had prolonged exposure to lead, insecticide, pollutants, or other chemicals?
Nope.
And do you have frequently lift heavy objects or perform repetitive motions?
Nope.
And then, lastly, can you perform your normal independent activities of daily living?
Yes.
Okay, ma'am, thank you. Then after that, we have to explain the procedure to the patient. Okay, ma'am, before we do the examination, I would like to ask you to remove all your clothing as well as your jewelry and put this examination gown. And initially, I will have you to sit comfortably on the examination table or bed, but expect that there will be several different position changes through the different parts of the examination. And then, ma'am, I'll make sure that I will explain to you its position before the start of the particular examination. And then, I will also want you to know that this examination will take considerable amount of time to perform and that I will provide rest periods as needed. And then there will also some actions that I need you to perform, such as counting backward or hopping on one foot. It may seem unusual, but those activities are part of comprehensive neurologic examination. Alright, ma'am, rest assured that all of the documents are completely confidential between the attending physician and me. So, do you have any questions, ma'am, before we start?
None?
Okay. So, I already told the patient to change into the patient gown. I already performed hand hygiene and provide privacy for the patient. And now I'll be starting to perform and assess the patient. So, I'll start by just talking to you. I'm just doing what you call mental status assessment. So, I'm first often noticing your behavior. Okay, you're awake and alert and cooperative and responding well. And then I'm also noticing your cognition. So I'm also gonna ask you some kind of silly questions. Okay, ma'am? So can you tell me what month it is?
May.
Okay, that's correct. Then can you tell me your favorite food?
My favorite food is spicy fried chicken.
Okay. Can you tell me who is the current president?
Bongbong Marcos.
That's right, Marcos is the current president of the Philippines. And can you tell me who I am?
You're Jamie, my nurse for today.
Okay, so she is oriented to person, place, and time. And tell me why you're here today.
Well, I'm here today to be assessed of, and we're doing videos for the assessment of neurologic system.
Okay, that's correct. She is also aware of the situation. And I also noticed that her dress is appropriate. Her facial expression is appropriate for the situation. I also need to screen her for depression and suicidal thoughts. This is a screening that's done at every healthcare, and suicide causes a high rate of death. So, ma'am, have you ever been so blue that you felt like hurting yourself?
No?
Have you felt depressed or unhappily lately?
No?
Okay, alright. So at that point, I can stop my assessment. If she answered yes to any of those questions, I would probe further with more questions about that. Alright, we're gonna move on now on the cranial nerve. We're gonna test for the olfactory, cranial nerve 1, the sense of smell. So what I'm gonna have you do is I'm gonna have you close your eyes and I'm gonna put something in front of your nose and have you breathe in and smell, and you tell me what you smell. And whenever you do this, use something that pleasant smelling, not something that's really stinky, because it could elicit like gag reflex or something like that if the person has a sensitive nose. Okay?
Cologne.
And that's correct. So that cranial nerve is intact. To test cranial nerve 2, you're gonna be doing 2 tests. So first is you're gonna look at the confrontation visual field, and you're gonna be looking at the peripheral vision. And then second, you'll be looking at the visual acuity using this Snellen chart to assess that. And then first, we're gonna test the peripheral vision by doing the confrontation of visual field test. And to do that, you're gonna have the client stand in front of you about arm's length away. So what I want you to do is I'm gonna have you cover your right eye, and I'm also gonna have to cover my left eye. So what I want you to do, ma'am, is to look at my eye and don't look at my finger. Okay? And I'll just have to tell you how many fingers you see, and you're gonna do this in the upper and lower visual fields, and you can also do that about middle of the visual fields. So here we go.
1, 2.
Okay, that's correct. Now we'll go to the opposite. Again, stare at the eye and don't look at my fingers.
3, 4.
Okay, good job. Now I'm gonna test the visual acuity using the Snellen chart, and to do that, I need you to stand 20 feet away from the chart. Look at the chart over there, and I need you to try to read the lowest line that you can read. And first, you're gonna cover your right eye and then your left eye, and then we'll do both eyes. Okay, you can cover your right eye. And what can you read?
8, D, E, F, P, O, T, E, C.
Okay, very good. Now you're gonna have to cover your left eye and do the same thing. Again, whatever line you can read, let me know.
8, D, E, F P O T E C.
Okay, now read both eyes and what line?
8 D E F P O T E C.
So she read from line 8, so that means she has 20/20 vision, and this means that she can see the same line of letters at 20 feet that a person with normal vision can see. Next, we're gonna be looking at cranial nerve 3, which is ocular motor, 4 trochlear, and 6, which is abducens. And we're gonna do several tests to check their function. The first one we're gonna do is we're gonna be looking for any involuntary shaking of the eyes called nystagmus. To do that, we're gonna take our pen light. We're gonna hold it about 12 to 14 inches away from the patient's nose. And then what I want you to do is keep your head still. Don't move your head and just use your eyes to watch where I move the pen light. And as you're doing this, you're gonna perform it in the 6 cardinal fields of gaze. And you're just gonna move it, and we're looking for any involuntary shaking of the eyes, so here we go. Next, we're gonna see how reactive the pupils are to light. And to do that, we're gonna dim the lights a little bit. And we're gonna have the patient stare off at the distant object. That helps dilate the pupils. And then we're gonna shine using our pen light at the side. And we're gonna see how the pupil responds. It should constrict, and then the other side, it should constrict as well. Say that their baseline pupil size was like 3 millimeters. It should go down to 1 millimeter, and it should happen on both sides. Okay, so stare off at that object rod on the wall over there for me. And that dilates the pupils. And we're just going to shine light at this side. Okay, it constricts. Then go over to the other side. Do the same again. And they both constricted and equal size. Next, what we're gonna do is we're gonna check for accommodation, and how we do that is we turn the lights back on. We just previously had them dim, but we now make it light again. We're gonna have her stare off a distant object that helps dilate the pupils. And we're gonna take a pen light, and you're just gonna slowly move it inward to the nose. And what you're looking for is that pupils constrict. They accommodate. And the eyes cross while looking at the pen light, so here we go. Stare off in the distance, please, and I don't want you to move your head or anything. Just keep it real still and just follow this pen light, okay? Ready? Okay, so now we can document, because we just checked all of the things with the eyes. We can document that pupils are equal, round, reactive to light, and accommodate to distance. So that's where that acronym PERRLA comes into play. We're gonna go ahead and test cranial nerve 5, which is the trigeminal nerve, and this nerve is responsible for many things like mastication. So what I want you to do is I want to have you clench your teeth, like bite down for me. And I'm going to feel the masseter muscle, which is right here. This should be nice firm ball. And then feel the temporal muscle. Now what I'm gonna do to also test that nerve, have her try to open her mouth against resistance. So try to do that for me. Okay, and she can do that. Going to test cranial nerve 7, which is the facial nerve. So can you close your eyes tightly for me? And open them up. Okay, can you now smile for me? How about frown? Then puff out your cheeks. Okay, and she did that with ease. So that cranial nerve is intact. Cranial nerve 8, which is vestibulocochlear nerve. And what I'm gonna do is I'm gonna clog one of her ears and then whisper 2-syllable word. And I'm gonna do the same on the other side, so she needs to tell me what I said. So you ready?
Yes.
Okay, I'm gonna clog this one.
Mascot.
Okay, very good.
Coffee.
Okay, and that nerve is in. And so what I'm gonna do is I'm gonna have you say ah. And what we want is that uvula to move up. Ah. Okay, and then we're just gonna test the gag reflex. I'm sort of just poke a little bit back there and elicit the gag reflex. Okay, there you go. And cranial nerve 10, the vagus is intact because she's able to talk. She talked to me without hoarseness and she's able to swallow. Then what we're gonna do is we're gonna test cranial nerve 11, which is the accessory nerve. So what I'm gonna have you do is move your head side to side, up and down. Okay, and then try to struggle against my resistance. And she does that with ease, so that nerve is intact. Next test cranial nerve 12, which is the hypoglossal nerve. And what I'm gonna have you do is I'm gonna have you stick out your tongue and move it side to side. Okay, and she does that with ease. Now I'll move on to your motor and cerebellar system. And the first thing I'm gonna do is to assess your condition and movement of the muscles. And I'm gonna check your muscle strength. So we'll start with the upper extremities. So can you please hold your hands out like this? And we would do that for a count of 10. So 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. And then, can you squeeze my fingers? Please squeeze as hard as you can. Squeeze really hard as you can. Alright, good. Okay, so the reason that we check strength in this manner for the neurological assessment is that this arm lift is part of the NIH stroke scale that used across the nation for the assessment of stroke. And doing the finger squeeze is an easy way to check assessment of strength of the upper extremities. And then for the lower extremities, we'll have you to lay back for a minute. And I want you to lift this leg up off the bed. And we do that for a count of 5. So 1, 2, 3, 4, and 5. Good, and then lift up the other foot to count of 5 as well. Okay, 1, 2, 3, 4, and 5. And then relax. Again, that is a part of NIH stroke scale. That's why we use that method. And then if you can press down against my hands. And then pull up against my hands. Okay, that also tells strength of the lower extremities. Okay, so now we're gonna do some tests of your coordination. And to do that, I'm gonna have you to touch each of the fingers as quickly as you can and do the other hand as well. Alright, good. And now touch your nose and then touch my finger, both as quickly as you can. Alright, that's good. Now we're going to check coordination of the lower extremities. So can you take your shin? Just run it down on your shin. And then do it also to the other side. Just run it right straight down. Alright, and then can you stand up for a moment? And I'm going to assess your gait and balance. And to do that, I'm gonna have you to walk like a couple steps over there, just like about 3 to 4 steps. And then come back and walk heel to toe like this. Okay, good job. Your gait is steady. And now I'm going to have you perform the Romberg test. And I'm gonna have you put your feet together. Then stand up straight and put your hands on your side. Then close your eyes. And we would count 20 seconds. And as you should be able to maintain the standing straight without falling over, make sure you stand near the client to prevent a fall in case the client loses balance. Okay, you can open your eyes. So the client's balance and coordination are intact. Okay, now we're gonna move on to check the sensory system. First, I'm going to assess the client's light touch, pain, and temperature sensation. And I'm gonna have you, ma'am, to close your eyes. And to test the light touch, I'm gonna use a wisp of cotton to touch the client. And I want you, ma'am, to say yes when you feel it.
Yes, 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 yes.
Okay, good. To test for the pain, I'm gonna check your sharp dull discrimination by using this paper clip. Then you're going to tell me whether you feel sharp or dull. Okay?
Sharp, 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 dull, sharp, dull, dull, sharp, 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 dull, dull, sharp, dull, 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 sharp, sharp.
Alright, good. Last thing to test for the temperature sensation. Eyes closed and hold out your hand and tell me what you feel.
It's hot, cold.
Okay, good. You can now open your eyes. Then next, we're gonna test for the vibratory sensation, and to do this, I'm gonna strike a low pitch tuning fork on the heel of my hand and hold the base of the distal radius of the client. And can you tell me, ma'am, what you feel?
I can feel the vibration.
Okay, and the forefinger tip, what can you feel?
Vibrating.
Alright, and the medial malleolus.
Vibrating as well.
And lastly, on the tip of the greater toe, what do you feel?
It's vibrating also.
Alright, the client correctly identifies the sensation. So next, we're gonna test the sensitivity to position. And I'm gonna have to close your eyes and tell me the direction it is moved, okay?
Up, down.
Alright, the client correctly identifies the movement. And the next, I'll be testing for the tactile discrimination. And again, I need you to close your eyes and open your hand for me and hold this. Okay, ma'am, can you identify to me what object is this?
A key.
Okay, that's right. On the other hand,
Paper clip.
okay, good. So the client correctly identifies the object. So now we're moving on to testing your reflexes. And I'm going to start the test with the deep tendon reflexes. In your biceps, I'm going to have to partially bend your arm at the elbow with your palm up. And I need you to relax your arm here for this to work, okay? And then, mom, I'm gonna place my thumb over the bicep tendon and I'm holding the pressure on it firmly. And I'm gonna use the pointy part of the reflex hammer and you have to give it a good quack. So I could feel the tendon moving and I see her finger move, so that's good. And we're just gonna do the same thing to the other side. Alright. Okay, next I'm gonna assess the brachioradialis reflex and I'm gonna have you flex your elbow with your palm down. And I'm gonna use the flat side of the reflex hammer to top the tendon at the radius about 2 inches above the wrist. Alright, good. And then repeat on the other side. Then I'm gonna test the tricep reflex, and to do this, I'm gonna have you hang your arm freely while I support it with my non-dominant hand with the elbow flexed, and then I'm gonna use the flat side of the reflex hammer to tap the tendon above the olecranon process. Okay, so the elbow extends and the muscle contracts, so that's good. Then I'll repeat to the other side. Okay, so next I'm going to assess the patellar reflex, and I'm gonna have you to let both of your legs hang freely. And I'm gonna use the flat side of the reflex hammer, and I'm gonna tap the patellar tendon, which is located just below the patella. Alright, good. Then I'm gonna repeat it on the other side. And last one for the deep tendon reflexes is the ankle clonus. And to do that, I'm gonna place my one hand under the client's knee to support the leg. Then I'm gonna briskly dorsiflex the foot toward the client's head. Okay, good. No rapid contractions elicited on the ankle. Then I'm gonna do the same thing to the other side. Okay, good. Now I'll be testing the superficial reflexes, and I'm gonna start with the plantar reflex, and to do that, I'm gonna use the end of the fork to elicit the superficial reflexes whose receptors are in the skin rather than the muscles. So with the end of the fork, I'm gonna stroke the lateral aspect of the sole from the heel of the ball of the foot, and I'm looking at the flexion of the toes to occur. Okay, good. Then I'm gonna do it to the other side. Alright. And lastly, for assessing the reflexes, if you suspect the client has some meningeal irritation or inflammation from infection or subarachnoid hemorrhage, you're gonna assess the client's neck mobility. And to do that, first make sure that there is no injury to the cervical vertebrae or cervical cord. Then, with the client in the supine position, you're gonna place your hands behind the client's head and flex the neck forward until the chin touches the chest if possible. So the client can easily bend head and neck forward, so that's normal. And then we'll test the Brudzinski sign, and as I flex the neck, you have to watch the hips and knees in reaction to your maneuver. And her hips and knees remain relaxed and motionless, so that's good. She's negative from Brudzinski sign. And to test the Koenig sign, you have to flex the client's leg at both the hip and the knee. Then slowly straighten the knee. Okay, did you feel any pain?
No.
Okay, that's good. No pain is felt, so that means she's negative from Koenig sign. So ma'am, that's all for the assessment. Thank you so much for your cooperation and have a nice day. So I will ask my patient to change her patient gown into her clothes, and I'll be performing proper hand hygiene. Also, if there are any signs of abnormalities, we want to refer them to other healthcare provider for further evaluation. And then after that, we are now done with the assessment.